And a study finds parents struggling to spot signs of mental distress in their children and how online experiences may be affecting them. Only 3 in 10 parents reported having regular conversations with their children about online safety. And for more on youth digital habits and stress, Ms. Tham Yuen Han, who is a clinical director at We Care Community Services, joins us now. Yuen Han, good to have you with us. Now, today, let's move away from the more commonly talked about direct triggers like cyberbullying and doxing. That's been covered extensively by our program. But we also hear a lot about FOMO, for example, the fear of missing out. There's also social comparison and doom scrolling, for example. Which day-to-day online behaviors are actually most concerning for young people?
I think both FOMO, the fear of missing out, as well as doom scrolling actually are equally concerning for young people, especially the very young adolescents, especially also because even young people are at the stage where they are forming their social identity. So when they're constantly going online and comparing themselves with other people, at least that's going to impact their own sense of self-identity and self-worth at some point, Of course, I think a lot of time we don't want to just look at the number of hours they spend on their digital devices. I think what is more important and a more pertinent question is to ask, what are they using their digital devices for? If they are using it primarily for research purpose, for studying purpose, or for connecting with their friends, for social connection, that's actually a very important use of social devices. However, if they are using the phone primarily as a way of disconnecting from real-life face-to-face interaction, and they're using it as a way of escaping or avoiding difficult situations in their life, difficult emotions, or some challenges that's going on in their real life, and using the digital devices as a way to numb or to escape, then I think that there is some room for concern as well.
Yeah, and if numbing or escape is what the young person is trying to get to with the devices, and they're already anxious or stressed, can things like FOMO and also social comparison then create this vicious cycle where they go online to find relief, but they actually end up feeling much worse?
Yes, certainly. I think, we're constantly checking their phone. Basically, it's a very reinforcing behavior. And the more they check, actually, the more they reinforce the anxiety. Of course, at the first time, the checking may actually provide some very temporary relief of the anxiety. However, when it becomes very compulsive, it basically get into a very self-reinforcing loop. And overall, the baseline anxiety over time actually will becomes a lot more elevated compared to normal. And the nervous system never gets to settle down, Actually, even when it comes to when they're off their phone, they're constantly worrying about what's the next thing that's coming up, especially if they're concerned about things that's going on that's affecting their identity, their social connection with their friends, for example. Okay? Then actually it leads to a very constant loop of worrying about what are they thinking about me? Am I good enough? How is it going to affect me, with my friends, with my life and going forward?
So, Yuen Han, how can parents then tell the difference between what is normal teenage behavior and also the signs that a young person's online life is beginning to really affect their mental well-being?
Well, we say that actually it's not a single event that, that's indicative of some problem that may be coming up. We would suggest that, parents look for shifts in certain patterns in the behavior of their adolescent. For example, when they start withdrawing from family or friends, when they prefer to spend their time online digitally rather than, having face-to-face connection, or they begin to miss out on things which they used to enjoy doing. So those are some of the, quite obvious signs. Of course, at the behavioral level, when you begin to see shift in the patterns of their behavior, for example, if a child not used to be, quite cheerful, and engaging, and then suddenly becomes quite quiet and very low in mood, and then there's sudden flashes of irritability or distress, or when their phone access is for whatever reason is blocked or removed, and they become highly irritable and highly distressed, then these are some of the signs that we want to be concerned about.
So looking out for these sudden shifts in that way. And for parents who notice these shifts and then they want to help, but also not simply impose a blanket screen ban, which can be, quite alienating. What are the most effective ways they can actually do this and connect with their kid at the same time?
Well, I think one of the most important things that we always advise parents to try to do is to stay curious, to be curious about what their children are using their phone for. Be curious about, hey, what you do, what you spend time on, what you find interesting, Try to even, get involved in some of those activities, the online apps, or the online games, for example, that your adolescents may be engaging in. Okay? Instead of be too quick to judge that, those are not good and those may have very negative influence, because we never know until we actually get to know more about what they're engaging with. Now, the other thing that we also want to, suggest to parents is to not to take too drastic actions to immediately curtail screen time or to basically confiscate or impose very strict rules, on the use, to learn to negotiate, especially with the late adolescents, who are developing a sense of, self-control and wanting to have a sense of identity and to establish a sense of autonomy as well. It's good to be able to establish and to negotiate with them some clear boundaries on some do's and don'ts. For example, having quite clear boundaries on handphone use at certain time of the day or at certain situations or events. For example, no handphones during mealtime. But of course, when parents establish boundaries like that, they also must be prepared to mirror the same behavior themselves as well.
Yeah.
So it is a learning process for both parents and their children.
Yes, walking the talk as well is very important. So Yuen Han, thank you so much for sharing your insights with us. That's Tham Yuen Han, who is a clinical director at We Care Community Service.